Over the years, the global response to HIV shifted from saving lives to focusing on viral suppression. This change led to reduced funding for critical CD4 testing, which helps identify patients at high risk for opportunistic infections and severe disease. Today, over 4 million people live with advanced HIV, CD4 count less than 200, with more than 600,000 deaths annually. Many preventable if better care systems and diagnostics were in place. With fewer CD4 test manufacturers serving low-resource settings and limited diagnostic options for life-threatening infections like tuberculosis, cryptococcal meningitis, and pneumocystis pneumonia, advanced HIV has fallen into neglect. New research efforts are sparse, and tools for diagnosing and treating severe opportunistic infections remain scarce. Addressing this crisis requires renewed attention to mortality, investments in new diagnostic tools, and sustained support for CD4 testing. Advanced HIV may not fit the traditional, neglected disease definition, but in many regions, it's being treated like one. Shifting focus back to the sickest patients could reduce preventable deaths and strengthen global HIV response systems, where they're needed most.